Welcome to a presentation about our study Nobody Listened.
My name is Sarah van Aken, clinical psychologist and PhD student at Real Life Research Group KU Leuven and researcher at University College Leuven-Limburg.
My name is Neeltje Krombach, midwife and postdoctoral researcher at the Department of Development and Regeneration, Real Life Research Group KU Leuven.
Becoming a mother is a unique life event that can be overwhelming. Perinatal mental health problems occurring during pregnancy or in the first year following birth affect approximately 20% of women. An infant's mental health cannot be considered separately from that of its primary caregiver. As young children rely on their caregivers for the development of their capacity to self-regulate, the quality of parenting is crucial. Infant regulatory problems like excessive crying, feeding or sleeping problems can negatively influence the mental health of the child in the long term and compromise the mother-infant relationship. Therefore, the prevention of intergenerational transmission of mental health problems is crucial. In order to do so, it is important to promote mental well-being in future parents and their infants, and to identify mother-child dyads who need professional support and early intervention. Previous research has mainly focused on the experiences of mothers who access the perinatal mental health service for their own mental health problems. But little is known about the experiences and needs of mothers who access an infant mental health facility because of their infant's regulatory problems. Given the mutual influences of parent-infant interaction, insight into the experience and needs of these mothers can add value to the development of care pathways and preventive care of perinatal and infant mental health.
For this study, an exploratory qualitative research design was adopted. We conducted 13 face-to-face semi-structural individual interviews to explore the experiences and needs regarding professional support prior to participants' admission to an infant mental health day clinic. For the analysis, we used the Qualitative Analysis Guide of Leuven, QAGL. Analyzers identified 3 major themes and 3 sub-themes as seen in the slide. Experiences of pregnancy, birth and parenthood was often not in line with the expectations of the mothers. They often expected it to be happy and joyful, while against their expectations, reality often was very intense. This became even more so if they encountered complications in this period. Despite this, mothers tried to pretend all was well, as they thought that was what expected from young mothers. In retrospect, it made them realize that it was not easy for others to see how they were struggling with new motherhood. However, throughout the trajectory, mothers did not feel that their needs were met, not by professionals, but also not by partners or close family members. While some realized they did not explicitly show their despair, some said they screamed for help, but no one really listened. This significantly challenged the mother's resilience. Findings of this study have learned us the following. Mothers indicated situations they encountered throughout the transition into motherhood that challenged their resilience. We suggest healthcare professionals to focus on the following aspects in perinatal care. Mental well-being as a standard aspect of perinatal care. Awareness of quality of sleep and sleep deprivation. Managing expectations versus reality, and awareness of availability of social support.